The healthcare industry is ripe for disruption, but transforming the entire healthcare ecosystem starts with transforming the conversation around it. What challenges and inefficiencies are leading to poor patient outcomes? How will technological innovations influence the evolution of the healthcare ecosystem? What's at stake for patients, payers, providers, and technology partners within this ecosystem? Welcome to Getting After It, Transforming the Healthcare Ecosystem. Join Mike Simmons and Jeff Fritz as they navigate today's complex healthcare ecosystem by sharing expertise and insight on these issues and more in each episode.
Hey everybody, Jeff Fritz. I'm the incoming CEO of Andros. I'm really excited to take on this opportunity to help Andros enter the next chapter of its life and our relationship. As we get to know each other better, I really want to encourage communication. That's how we're going to learn what your business is doing and how we're going to adjust our business to meet those needs. It's a team effort. We've got some great connections that you know about within our organization, and I really encourage you to pick up the phone or send an email or just keep the communication open. Really excited about this next chapter together and the opportunity to partner with you. Thank you.
Hi, I'm Mike Simmons. I'm the founder of Andros, and I'm excited today to introduce you to Jeff Fritz, who is coming on as the new CEO of Andros. Welcome, Jeff.
Hey, Mike. Thanks. I'm really excited to be here. Andros is a unique opportunity for me personally, and it's just been a pleasure getting to know you as we've worked through how to make this next chapter of Andros just a wild success.
It is an exciting time. It's an exciting time for Andros because we're growing. We're growing as a company, want to bring our solutions and products and services to hundreds more customers. And there's a lot of hard work involved in scaling a business. And that's why I'm particularly excited to welcome Jeff as CEO of the company, because he's got a lot of experience doing that.
Thanks. And I'm excited to partner with Mike. You know, it's a rare opportunity when there's a window that opens a new chapter of a company and you have a founder of a business welcoming in and coordinating with a CEO to help take the company into that next chapter. We'll be on the board together, working together on making Andros a great company for the foreseeable future.
So Jeff, why don't you share a little bit about your career up till now in healthcare and technology?
I've spent my whole career in healthcare. And when I say whole career, I've had the opportunity to work in different places in the healthcare supply chain. I feel like all of my experiences led up to this opportunity to work with Andros. Early in my career, I was working with building a business around the employer sponsored benefits area, self-funded medical. Gave me a lot of great context in healthcare. And then I moved into software platforms that support things like consumer-driven healthcare, which was a big new change and shift in healthcare. And recently, I've been working a lot with the payer community or insurance companies, large insurance companies around government programs, Medicare, Medicaid, and the shifts that are going in Medicare and Medicaid have really opened opportunities for entrepreneurial organizations to lead the way. And that's what's really got me excited about Andros. I mean, technology that's supporting a new way or a more innovative way on solving these solutions has really got me excited.
So I think that's really interesting because, well, government programs are the fastest growing part of the healthcare industry, and that's certainly true in our business as well. And you know, there's what I think about, you know, working on this business for 10 years. We've really started to lay the foundation for what a more modern pathway to better provider data, better business transactions within the provider to payer communities. We're laying the foundation for that. That's what drives our business, a lot of our business today.
I've been thinking about the connection that payers and providers are starting to intersect more and more. The provider organizations are starting to take more risk. They're starting to be more and more interested in how they manage a broader spectrum of care. And the payers are embracing that by getting tighter with what the And so that's where Andros lives, right? Is connecting these payers and providers, and that flexibility that it affords these organizations to move in the directions that the market is taking them. I think that's really special.
Some of the things that I think a lot about are how the work that we do and the software that we're building, the data that we're learning more and more about how to manage, is not only having an impact on our direct clients, which are payer organizations and provider organizations, but also the individuals that are going through the process, right? The individual practitioners or small business owners, small practice owners that are responsible for so much. Obviously, their patient's health, but also the business aspects of running a practice, running a small group, running a large group, running an insurance plan. All of those, they're balancing so many different competing needs for different stakeholders. And everything that we can do to make their lives better is a win, not only for them, but also for their patients. And it's a win for us as we are building a really awesome business.
I would expect that the providers, the physicians, the nurses, anybody who's a licensed practitioner in the supply chain doesn't wake up every day and say, oh my gosh, I sure hope I can work on credentialing or being a member of a network for a plan. They wake up and they want to deliver care.
Absolutely.
And so the pressures of all that flexibility in the marketplace have just got to be a huge distraction for them. And that's a unique opportunity for Andros.
Yeah, to the extent that we can take that off their plate, make their lives better, they're dedicating that much more time to patient care, which is ultimately the goal. Better access to high quality patient care.
When I think about the ecosystem, the provider ecosystem, and they're working with all these payers, there's a lot that goes to supporting those organizations. And the word I guess I'm thinking of is federation. The more there's a federation where the different partnerships that a company like Andros forms and supports, and how we come together to support the goals and objectives of the provider organizations, the whole healthcare ecosystem. I think that's going to be the real opportunity over the next 10 years for health systems and for the healthcare ecosystem as a whole, all the way down to the patient, is how do we come together as solutions, work better together to get better results for the end consumers.
Yeah, absolutely. That's why it's so important to the work we're doing to consolidate data into one asset, understand it better, model it better, make that data and those processes available to integrators through an API. All of that speaks to that of creating that ecosystem that's federated, and that's a really exciting opportunity for Andros. You're totally right.
What I found works well for me and has worked well for me in the past is already happening within Andros. There's a real effort to connect with the customer. The customers being these payer organizations as well as providers and provider organizations. And I feel like it's part of my philosophy to continue to expand on that, the answers are within our customers. The answers are within what they're experiencing and the challenges they face and how to make their lives better. So if I were to have one message to our partners and all of our clients, and honestly our staff, is let's keep that going. Let's make sure that there's a spirit of partnership and listening that happens with our clients, because that's where the answers are, and that's where we get all of our feedback on what we're going to build.
Yeah, 100%. That's why we put number one in our operating principles is make decisions with our customers' best interests in mind. Right. I fully agree with you. All right. Well, this has been great catching up, Jeff.
Thank you.
Welcome to Andros.
Thank you.
Excited to have you on the team. I'm excited to continue to support you in the business with contacts or context about the business. Really exciting chapter in our journey, and I'm so glad to have you on board.
I'm honored. I really am. I'm honored to carry forward the legacy that you started as the founder of this great company, all the things that the employees and customers have put into this business to make it is what it is today. Yeah. And honestly, I'm excited to work with you. I'm excited to work with you as we take it into the future and make it even a better organization than it is today.
Awesome. We have to thank our customers and our team. They are awesome. Yeah. Really doing a great job serving our customers, and our customers are doing a great job helping us to understand what's really needed in the market and have supported us along the way. So it's pretty exciting.
It is.
Welcome.
Thanks, man. Appreciate it.
You've just listened to another episode of Getting After It. If you enjoyed today's show, don't forget to like and share to spread the word. Subscribe to catch future episodes and visit andros.co/podcast for more. Check back next week for more information on what's happening in healthcare and how we can create a better healthcare ecosystem that provides better care for all.